How's the sound check?
Dr. Roos and Dr. Reimer, were there any opening remarks or are we heading right to questions?
No, I think we both have opening remarks.
Then take it away. The floor is yours.
Okay, yeah, good afternoon. I'm Brent Roosen, Manitoba's Chief Provincial Public Health Officer. I have a few comments before I pass it over to Dr. Reimer. So as of today, there are no cases of B11529 or Omicron variant that have been detected in Manitoba. Province can confirm that all positive travel-related specimens are being sequenced. We continue to monitor the situation and work with the federal officials in the fight against COVID-19 and these variants. So all Manitobans should be adhering to the federal travel restrictions that can be found on the federal website. If a case of Omicron variant is found here, we will be announcing that. Um, Manitobans are still protect ourselves from COVID-19 as well as its variants, and we do so by continuing to follow the public health measures that are in place, focus on those fundamentals that we've all become so familiar with, staying at home when you feel ill, going for testing right away and isolating until you get your results. Washing your hands, covering your cough, wearing a mask. And so these are all our best lines to prevent the transmission of COVID-19. And then our best line of defense is vaccination. So if you're eligible to be vaccinated, please do so as soon as possible. Do receive those second doses, receive a third dose if you're eligible as well. So this is what is making such a difference in this fourth wave for us. But we still need many Manitobans to get vaccinated. You can find a location to get vaccinated at protectmb.ca. You can book your appointment online or visit a walk-in location. So as of December 6th, public health orders will require youth aged 12 to 17 years attending indoor sports and recreation facilities. This includes schools to provide proof that they have received at least one dose of the Pfizer or Moderna vaccine. If they have not received a single dose, then they must provide proof of pharmacist confirmed negative result from an approved rapid antigen test taken within 72 hours before they participate. These orders do not allow other healthcare providers to confirm a test result. The orders apply to all aged 12 to 17 entering any indoor sporting or rec facility to watch or to participate. These facilities include, but are not limited to, school gymnasiums, classrooms, multipurpose rooms, community facilities such as arenas. Both indoor practices and competitions are subject to these orders. Families are encouraged to contact their local pharmacy to confirm that the pharmacy provides these tests. Pharmacies set their own prices for these service, so people are encouraged to ask about the cost. For clarification, approved rapid COVID-19 tests include the Abbott Panbio COVID-19 antigen test, the BD Veritor antigen test, any other test for COVID-19 approved by the Chief Provincial Public Health Officer. All other public health orders and guidance remain in place. So it's a responsibility of facility operator, including public and independent schools, to ensure public health orders are being followed. Today is World AIDS Day. I'd like to start by issuing, allowing people to know that our HIV report is now online. Some of the highlights there include that we've had 117 new cases of HIV being identified, which is slightly less than that in 2019. The theme for World AIDS Day is End Inequalities, End AIDS. And so HIV and the stigma surrounding it continues to be a significant public health concern in Canada, around the world, and including Manitoba. So those populations most at risk of HIV have faced long-standing health and social inequities, made worse now by the COVID-19 pandemic. So back to that report, although we've seen very slightly less, not significantly less number of diagnosed cases in 2020, we saw significant reductions in the amount of tests performed, which demonstrates some of those challenges that we've seen through the pandemic. Heterosexual sex and the sharing of drug injection equipment appear the largest drivers right now in Manitoba. The 20 to 29-year-old cohort accounted for the highest proportion of cases among females, which is about 34.7%, and the 30 to 39-year-olds accounted for the highest proportion amongst males. So Manitobans are encouraged to get regular testing for HIV and other sexually transmitted diseases. Speak to your healthcare provider regarding prevention, testing, and treatment options. Around 25% of people living with HIV infection are unaware that they have HIV, and that can contribute to this spread. So it's important to get tested if you're unsure of your HIV status. You can use your name or an anonymous coded number. All other sexually transmitted disease testing is available at all physician clinics, community clinics, hospitals in Manitoba. So all these services are confidential and they're free. And those living with HIV are encouraged to stay connected to care. There are such effective treatments for HIV now, and people living with HIV, this is treated as a chronic infection. We can bring the level of that virus down to undetectable levels and to minimize the risk of that being transmitted to others as well. So certainly to the loved ones of Manitobans that we have lost to HIV/AIDS, I offer my sincere condolences. We're continuing to advise Manitobans to get your flu vaccine. Manitoba continues to have doses available. It's not too late to book your appointment. This year, like last year, we need to ensure that we do whatever we can to decrease the strain on our healthcare system, and getting a flu shot is yet another way of doing just that. So the flu vaccine, as well as the high-dose vaccine, are available at local public health offices, nursing stations, pharmacies, doctors' offices, and community clinics. I recommend you contact your provider to set up your appointment. And so before I pass it over to Dr. Reimer, I wanted to reiterate a thanks to the staff at CADM Provincial Laboratory. There's been a number of groups and staff across government who are working continuously to aid in our response to COVID-19. CADM Provincial Lab is conducting testing, research, education to enhance the health and wellness for the province of Manitoba. They've been performing numerous tests, as you can see from our test numbers, 2,400, 3,700 over the last several days. And so really want to say thanks again to all their hard work and dedication to the health of Manitobans, and wanted to ensure we gave them their thanks for this. So thanks, and I'm going to pass it over to Dr.
Thank you, Dr. Roussin. Since the Protect MB Kids campaign launched last week to begin immunizing children aged 5 to 11 across Manitoba, we are seeing very good uptake. This is so encouraging. We want to keep up the great momentum that's already underway. As of today, 14,101 children in this age group have received their first dose. In total, there are 28,000 vaccinated or committed with an appointment already booked. Approximately 17,000 pediatric appointments have been booked at urban, Indigenous, and regional vaccine clinics from November 30th to December 31st. We expect that parents will continue to make appointments as we approach the holiday season. And we know that these numbers may not include all of the doses that have been provided at pharmacies and physician clinics. And so we expect to see those numbers going up as well. Last night, I had the privilege of participating on a medical panel at the Doctors Manitoba virtual town hall event. Parents and guardians were invited to ask questions about the vaccine, its safety, its effectiveness, and what they can expect their children will experience in terms of at the vaccine sites, as well as short-term symptoms following immunization. I want to say a huge thank you to everyone who sent in questions. There were so many great questions being asked. Today, I'd like to highlight some of the ways that parents and guardians can help make their kids' vaccination day a good experience for everyone. We can't emphasize enough the importance of a little bit of planning. Sometimes we might think that it's helpful to surprise a child about their vaccine on immunization day, because that might give them less time to get worried. But an unexpected vaccine can be frightening. It can damage trust, and that can affect your children's future healthcare decisions. Providing 1 or 2 days notice gives kids a chance to feel and to become prepared. Asking kids to share how they're feeling about it builds trust and a feeling of safety. Inviting them to ask questions will make for a productive conversation that values your child's concerns and really tells them that their concerns are valid. I encourage you to tell your child that there are a lot of good reasons to get the vaccine. The top 3 are the easiest to remember. First, the vaccine can stop you from getting sick with COVID. Second, it allows you to protect the people around you, your friends at school, relatives, teachers, people in the community. And third, the vaccine will help move us towards getting back to normal and doing all of the things that we love. Even when kids have heard the facts, it is absolutely normal for them to still feel a little worried about getting a needle. So you should try to affirm their feelings instead of trying to talk them out of being nervous or scared. When it comes to vaccines, facts are our best tools. You can tell your children that the vaccinations are safe, that the needle will pinch or squeeze for a short time, and that their arm might feel sore afterwards. They may also experience mild flu-like symptoms and fatigue for a day or two. And so it's okay to take it easy if you're not feeling your best. The pediatric vaccine is 1/3 the dose of the vaccine that's given to older people. It's being administered as a 2-dose series with 8 weeks between doses, with the only exception being children who live in First Nations communities. Health Canada's evaluation of the vaccine was thorough. The safety of the vaccine is not being disputed by any of our medical or scientific authorities. One of the things that you can do to help your child on the day is to ask them if they would like to bring something along for comfort or for distraction. Perhaps a stuffed animal, a small blanket, fidget toys, books, an iPad. Something will help them pass the time and give them something else to think about. Involving your child in selecting the special item or items that they would like to bring along can be fun. So those are a few ideas. You can find more on the Protect MB website in the resources section for parents and kids aged 5 to 11. You'll find there a nice video with a local pediatrician and a sock puppet named No Name talking about needles and vaccines, and it's aimed for kids. We also have a printable coloring sheet for kids covering some of their most common questions. The vaccine is available in hundreds of locations, including our dedicated vaccine clinics, physician offices, pharmacies, urban Indigenous clinics, and pop-up community clinics. The vaccine finder map on our website makes it easy to find a place to go near you. And it's been updated to include all of the locations that have the pediatric vaccine. If you still have questions about vaccinating your older or younger children, your family's healthcare providers are ready to help. So please call them, visit our website, make sure the information that you're consuming about vaccines is based in good science. And above all, I want you to remember that these vaccines are not risk-free, but the decision to not vaccinate your child puts them at more risk than the decision to vaccinate them. I'd like to give a bit of an update on the in-school vaccine program for kids aged 5 to 11, which starts this week and will be underway in school divisions province-wide in the coming weeks. We are so grateful to the schools and school divisions that are participating in this important outreach, which makes it easy for children to be protected against COVID-19. On this first week of December, there will be 9 in-school clinics and many more to come the rest of this month and into the new year. Schools with clinics have been sending home information about the vaccine and consent form to parents and caregivers in advance. In some cases, these schools will offer vaccine clinics outside of school hours as well that are open to families and the community. The National Advisory Committee on Immunization recommends a precautionary approach on waiting 14 days before receiving or getting another vaccine. But they also recognize there may be individual circumstances where the 14-day waiting period can be shortened. One of the things that we in public health worry about is that kids have missed a lot of their regular school-based vaccines, and that we want them to get the influenza vaccine as well. So if you have already scheduled an appointment for your child or your children to receive other childhood vaccines or the influenza vaccine, or if perhaps there's a school-based vaccine program that's coming around before or after getting their COVID-19 vaccine, please don't cancel or delay these appointments, even if it falls within 14 days of the COVID-19 vaccine. NACI's advice was not related to any concerns around the safety of the vaccine or effectiveness of the vaccine if given close to other vaccines. It was about surveillance and understanding when there are side effects, what the cause may be. So we don't want children to miss out on other vaccines because they're holding out for the COVID-19 vaccine if those other appointments are already booked. Manitobans continue to book their appointments for the 3rd dose, the booster dose, which is recommended to be received 6 months after the 2nd dose for all adults, so that's age 18 and over. The 3rd dose is important because we are seeing waning immunity over time, and we need to ensure that everyone is fully protected through this 4th wave. And that's why the eligibility is opened up to all adults 6 months after their 2nd dose, although you can look on our website for a list of individuals where we particularly recommend that they get that booster as soon as they hit that 6-month mark. Based on the 6-month eligibility period, 44% of Manitobans have received their booster dose. So this represents 55,501 booster doses. All in all, a total of 74,354 3rd doses have been given. This would include booster doses, 3rd doses for people who are immunocompromised, additional doses for people who received non-Health Canada approved vaccines, as an example. So if you are over the age of 18 and it has been 6 months since you're receiving your 2nd dose, it's time to check the date of your last dose and talk to your healthcare provider, look at our list of conditions and book your appointment. Visit a pharmacy, visit your healthcare provider or a pop-up community clinic. We are also working on our online dashboard to make sure we're providing updated information to Manitobans about vaccines, including 3rd doses and the 5 to 11 campaign. We expect those adjustments will be made soon. I want to address a few questions I've seen circulating on social media recently. The first is around boosters for the 12 to 17-year-old group. So at this time in Manitoba, we have not made any recommendations for boosters for teenagers. All of the major studies that we used to inform our booster decisions looked at adults. So we are waiting on further information before we move forward with anyone under the age of 18. This also applies to Indigenous children, including those living on reserve. The First Nations Pandemic Response Coordination Team at this time has not created any recommendations for boosters for First Nations people who are under the age of 18. However, we know that information is coming and changing regularly, and that includes information about Omicron, which might push this topic forward. So please do keep an eye on the recommendations to see if they do change and apply to someone in your life. Speaking of Omicron, there is a lot of talk online about what this means about the vaccine. The short answer is that we really don't know yet how well the vaccine works against Omicron. The longer answer is that we are not back to square one. Thankfully, it is not a yes or no question about whether or not the vaccines that we have received protect against Omicron. Omicron is still the same coronavirus. Our bodies are fantastic at creating complex immune responses to vaccines that can target the virus in many different ways. So even if we learn that some of the immune response doesn't work as well against Omicron, we will still have good protection from other parts of our immune response. We need to wait to get more data before we know exactly how big the impact will be. But regardless of what we learn, the vaccine will help protect you. And in fact, it is still the best way to protect yourself against all variants of this virus, including this newest variant of concern. One final update before we go to questions. The provincial vaccine campaign is full of great success stories about caring people in our communities, organizations that are going above and beyond to provide safe, accessible, and culturally sensitive vaccine clinic options. Saint Amant provided a targeted pop-up clinic last week that was so innovative and totally focused on reducing barriers for people who want a vaccine in a smaller site. Community vaccine clinics can reach people in places where they feel comfortable, places that are familiar, and where they can see people that they know. The people with neurodevelopmental or physical disabilities who visited Saint Amant's Health and Transition Services site last week were greeted with warmth from friendly volunteers and staff. Some of these folks have not been leaving their homes very often over the past year, and we're so grateful to be vaccinated. A huge thanks to Saint Amant for hosting another successful community clinic and delivering hundreds of doses to Manitobans. I hear they even had some furry friends there to offer comfort and a calm experience. So sounds like it was a great experience for all. So thanks everyone for listening today, and we will now turn over to questions.
Thank you, Dr. Reimer. Thank you, Dr. Roussin. Up first, our usual format, one question, one follow-up from the Canadian Press. Steve.
Oh, hi there. Dr. Roussin, I note that the latest statistics continue to show that the Southern Health Region continues to be overrepresented in terms of case numbers, intensive care numbers, and deaths in the most recent announcements. Is there any contemplation of new measures to dampen the numbers in that region?
So we don't have any specific new measures that we're planning on implementing at this point. We do have increased measures there. We still have a number of public health measures throughout the province, and we're still, doing a lot of targeted work in that region to try to increase vaccine uptake. And so we're still following things, but we don't have any imminent plans of order change.
And I noticed within the region, the Seven Regions Health District has a very large number of active cases per capita. It's quite large. I know there was an outbreak on Sandy Bay, but the number of active cases seems to go well above and beyond that. Is there something else going on in the Seven Regions Health District?
I don't have any specific details to share on that. So we're, following all transmission that we can find. If there's any people are, putting the public at risk, then we'll definitely discuss those.
Up next from CTV, Michelle.
Hi, Dr. Rusin. Do you have any indication how many travel-related cases are being sequenced?
I don't have that right in front of me. I know the lab has done a very good job of sequencing all of our positive travel-related cases over the last number of weeks, but I don't have the precise number of how many that was.
Okay, that was very choppy. If you could reiterate that. Here's my second question, though. How many travelers from countries with these new restrictions are in isolation in Manitoba?
So I'll leave my camera off. Am I coming across okay now?
Sure.
Okay, so as our numbers there. So as far as the number of travel related sequencing done, I don't have the specific number. I know the lab moved quite quickly and started sequencing all travel related cases over the last number of weeks. I don't have the specific number of that. And then from the countries of concern where we had a listing provided. So we had around 24 cases, or not cases, sorry, 24 returned travelers in the last 2 weeks from those countries listed from by.
And sorry, Dr. Rusin, the number, do we have a number of travelers that might be isolating because of that? I think was Michelle's other follow-up.
Well, the 24 is the answer. Anyone who's returned from those listed countries in the last 2 weeks are required to isolate.
Okay. Apologies, I did not hear that. It must have cut out. Okay, up next, CGO. Skylar.
I thought I heard CJOB there, but I was just making sure. Thanks, doctors, for your time. I just saw some early returns on the myocarditis risk among pediatric vaccinations is virtually non-existent in the US. Dr. Reimer, clearly that's encouraging news.
Yeah, so they've given 4 million doses of the pediatric vaccine in the US. And so we're really in an advantageous position where we get to watch a country that is a few weeks ahead of us and see what their experience is. And so far, they haven't reported any cases of myocarditis in the 5 to 11 age group. Now, that may be because this is a lower dose. It's 1/3 the dose that adolescents and adults get. It may be something related to hormones in that age group. We're seeing that there might be a link to testosterone, which kids under the age of 12 will have lower levels of that. Or perhaps we're just early on and these are first doses and we will start to see something with second doses. But regardless of the reason, it's great news. We worried about myocarditis for this age group. And so to see nothing in the original trial and nothing in the United States so far is really exciting for all of us involved in the rollout, and hopefully very reassuring for parents who I'm sure felt some anxiety when we talked about that side effect in the past.
Great, thank you for that. I guess Dr. Rusin, maybe this one's more for you, or Dr. Reimer, whoever feels best suited to answer this question. I know for a lot of people, myself included, we were kind of waiting for this pediatric vaccine rollout as something that would be the real difference maker. in terms of our fight with the virus. Obviously, a big subset of our population now eligible to get that protection. Since then, we've had the concern of the Omicron variant. Has that dampened your optimism a little bit? What's your hope for the results from this rollout with the variant in mind?
Yeah, maybe I can take that question. We are very optimistic about how well this age group is going to impact what we see overall in Manitoba. The 5 to 11 age group was making up an increasing proportion of all of our cases because they weren't vaccinated. They didn't have access. And even with the Omicron variant being a potential risk that we haven't yet seen in Manitoba, but certainly could, the vaccine is still the best tool to protect Manitobans. And so we're still really excited about being able to include this age group and about the impact that it'll have on transmission we see in our communities going down over time. It's been really dramatic to look at the shape of this wave compared to previous waves and see how much lower the slope has been and how much better controlled things have been, even though for vaccinated people, we've had much, much fewer public health orders than with previous waves. So despite the fact that, for vaccinated people, we're functioning close to normal, this wave just has not seen the same sharp peak that we saw with previous ones. And adding this age group is only going to help with that, regardless of what variant it is. One of the nice things about when the pediatric dose was studied in children is that Delta was the main variant circulating at that time. So the 90%, 91% efficacy that they saw in the study was looking at Delta. So already looking at a variant that was more concerning than the original strain. And so we anticipate that, we don't know yet how well the vaccines will protect against Omicron, but they will protect against it. It's a variant, but it's the same virus. And so we know that the vaccine is going to produce immunity that will protect all of us.
Thank you. Now we go to global and
Hi, good afternoon. Dr. Roussin, you've said you don't want to restrict the freedoms of vaccinated people, and restrictions in the southern region have been in place now for more than 2 weeks that specifically target religious gatherings. Yet there hasn't been a single ticket handed out in the region at all since October 4th, and not one to a church in the region since midsummer. Do you think enough is being done to ensure the orders you put in are being followed, so you might not have to put more restrictions on those who are vaccinated and currently following the rules?
Yeah, so I think our public health approach is always multifaceted. So certainly the public health measures that we implement under the public health restrictions are one facet of that. And those measures aren't going to work unless they're adhered to a large degree. And so most Manitobans, adhere to rules that are set out. Enforcement is certainly a necessary piece in certain circumstances. So we have our enforcement table, and they will provide regular updates. So any issues related to enforcement, I will leave to them.
Okay, and Dr. Reimer, we've talked about how increasing vaccinations in a lot of these areas where we're seeing a low vaccine uptake is, the best way out of this, but it's also what we're hoping to do through these restrictions. I'm just wondering if you could comment a little bit on how we're not really seeing a large uptake still in some of these areas. I know since October 3rd, there's been less than a 5% increase in Winkler and just over 2% in the RM of Stanley.
Well, we knew that this was going to be slow work. There's been, really targeted misinformation campaigns for people who live in those areas, and they are being bombarded by scary sounding misinformation. And so it's going to take a long time for us to work with people in those regions to build trust and to help make sure that people have accurate information available to them. But I'm encouraged to see that we continue to see more and more people in those areas getting vaccinated. So, the numbers are obviously not going up as fast as we would like, but they are still going up. So every day there are still people in those areas deciding to go ahead and get vaccinated. And we will keep working with those communities to encourage that as much as we possibly can, and try to reach out in various ways to improve the trust that people have with the scientific information.
Moving now to CHVN and Taylor.
Hi, good afternoon. Just to clarify, how will that youth vaccination requirement work next week for gym class?
So I think things that are specifically related to schools and in class like that, I'd will refer that to education to provide a.
Sorry, I think I lost you.
Am I coming across okay now?
Yeah, we're good.
Okay, yeah. For things related to in school issues and how things will be taken care of, I'll defer that to education officials.
Okay, so then that means if there is a youth, say 13 years old, doesn't have that proof of vaccination, there's a chance that if there's indoor sports or a regular gym class going on, they can't participate.
So the overall goal of that is to ensure that we have as many vaccinated in that age group or tested, but on the specifics of how it's going to work in school, I'll defer to education.
Okay, thanks.
And now to the Brandon Sun and Aaron.
Good afternoon, everyone. Just a question about child vaccines, because for a lot of these children, they are being, this decision's being made for them. So I'm just wondering, even though we're seeing a really high uptick right now, are there any concerns about plateauing maybe further down the line, like we saw with a number of adults?
I mean, the individuals who are bringing their kids in right now are those who were really eager and engaged, and were just waiting for this vaccine to be available for their children. And much like we saw with every other age group, we expect that there will be a slowing of uptake over time. And in particular, when parents are thinking about their kids, they are usually a lot more cautious than they are even with decisions about their own health. So it's important for us to provide reliable information to parents as they're making this decision, because for a lot of parents, it is going to be a challenging decision to make. What we've seen in the science is that the decision not to vaccinate your child puts them at more risk than the decision to vaccinate them. But we do know that there's going to be parents who will choose not to vaccinate their children. And so it's just going to be very important for our campaign that we make sure that parents have every piece of information they need to inform that decision.
Okay, and just maybe again, but for cases in general, well, the positivity rate has been holding here about 5.2 for the last couple of days, and death rate has gone up. Normally, those are considered lagging indicators that we may be seeing the end of this. So, is it too early to tell, or too early to say if we are starting to see maybe an end to this fourth wave?
Yes, at this point, it's too early to consider things like that. We have been seeing case numbers over the last, we know that we have, pockets of under-vaccinated Manitobans that puts us at risk for higher. So we all just need to continue to get vaccinated if we're not vaccinated, continue to follow those fundamentals, and we need to continue to
Sorry, Dr. Rusin, you've cut out there. You continue to.
Yeah, we'll continue to follow our typical indicators that we've been following all along.
Okay, thanks.
Okay, thank you, sir. To the Winnipeg Free Press now.
Good afternoon. Dr. Rusin, we know that all travel-related positive results are being sequenced now, but will Manitoba increase the number of positives that are sequenced, or conduct any other type of sort of random sampling sequencing to detect the Omicron variant?
Yeah, so we have not stopped sequencing our positives. So we do sequence a number of our test positives going forward, and we're going to continue to do so. And we've also initiated, screening for this variant. So we're doing a lot of things to continue looking for and monitoring variants. We did scale back just on the reporting of variants just because we had such a high proportion of our variants being related to Delta. But behind the scenes, we're still sequencing, we're still screening. And if we find any variants of concern, such as Omicron, we'll be announcing that.
Can you just clarify what proportion of samples are being screened and sequenced now?
That varies over time, and so it depends on the circumstances there. So if we see a cluster of cases, there's no need to sequence everyone in that cluster. We'll sequence a couple of them. So it really varies what the proportion is. We're doing screening, but also targeted.
From Radio Canada, Anna Louise.
Good afternoon. So you confirmed the fact that there is no Omicron variant in Manitoba, and you are pretty optimistic, but have you already planned a protocol if the variant gets here in Manitoba? I mean, hospitals are already overcrowded.
Sorry, I didn't catch a lot of that. I can confirm we have not detected a case of Omicron in Manitoba. Right now, we're still learning about this variant, and our response is much the same as what we have right now. We have a number of public health measures in place to decrease transmission. We have our vaccine requirement, proof of vaccine requirement, number of places, capacity limitations in other places, indoor masks, and we're still looking to increase our vaccine uptake. So the planning is still for COVID-19, and as we learn more and more about this new variant, then we may have to adjust our response.
Okay, and you tell me that there are 24% isolated actually in Manitoba, and how Manitoba will make sure to find the person who have to be isolated.
So this work is done through the federal government, contacting and ensuring isolation of these individuals, because that's under the Quarantine Act. Manitoba is ensuring we're looking to see the proportion of these individuals being tested and following up in that manner, and we'll be doing quite significant contact investigations if we find a positive case.
Up next from CBC Manitoba, Alana.
Hi, Dr. Rusin. Is the province having to do anything to make sure that they have enough capacity in place to trace or test for Omicron?
So one, the lab works quite quickly with all of its um, counterparts across the nation, so they were able to rapidly set up an ability to screen, and then of course to sequence our tests. So our testing capacity is still quite good right now, and the lab's ability to look for this new variant is there. So the rest of our work is around what we've been doing up to now with our public health approach to testing, to contact tracing, to isolation, and to those fundamentals.
Okay. And Dr. Reimer, in terms of the uptake for the pediatric vaccine, is this what the province, or the numbers that the province has seen, is it what was expected? Is it more or less? And does the fact that there's still, spots available, through pharmacies and through the super site tell you anything about uptake, or is that more tell you something about what the supply is?
Well, the pharmacies and physician clinics only started getting their supply last Thursday, and some of them as late as November 29th. So certainly there would be a few days delay in people being able to see their pharmacist or their physician clinic compared to, say, going to the convention center in Winnipeg to get that dose. But overall, I would say the uptake is about what we expected to see. Our goal with this age group is more on the comfort of the children than it is on the speed of how quickly we can get them through our facilities. Obviously, we still want to be as fast as possible, but it's even more important that this not be a scary experience for kids, and that we create situations that are safe and comfortable for these younger kids to get their vaccine. So the fact that we haven't even had this vaccine available for a week at this point, and we already have over 11% of that population immunized, and that's just the ones that we have the data already submitted. That's really amazing numbers, and we're excited to see that continue to go up. But we're really happy with how quickly people have signed on already.
Okay, we have about 5 minutes for our little roundtable. Any other questions unasked or unanswered yet?
Dr. Roussin, it's Brittany from Global. Today's supposed to be the day we get the test positivity rates for each region. Those haven't been updated yet, and I'm wondering if you could tell us what you've seen currently in the southern region for the past 2 weeks.
Yeah, so those will be updated. I can say things have been fairly stable with the test positivity rate in essentially all regions.
And I guess what does that mean to you if we were seeing anywhere from 14 to 16% in the Southern Health region, and restrictions that have been placed for a few weeks don't seem to be working?
So when you see a test positivity that high, the real concern is that you're missing many cases. So we know with our seroprevalence data that we miss many cases for every test positive that we get. The higher the test positive, the more likely that we're missing those cases. So that's it's still a concern with that, and we need to ensure Manitobans follow the public health orders that are in place, get vaccinated, and follow those fundamentals that we're always talking.
At what point do you think the health orders aren't going to work in those regions? If we keep seeing those test positivity rates going up, we keep seeing vaccine rates not increasing at a steady rate, and like we said before, not a lot of enforcement there, and we're still seeing people breaking the rules. What do you do, and how long do you wait?
Well, there's a lot of issues in play with this. So public health orders are just one of our response to the pandemic. We have a multi-layered approach. There's a lot of work being done in the region for testing, for contact tracing, for isolation, for vaccination. So it's multifaceted. So there isn't a single number to look at. We know we had high test positivity there. We know we see a disproportionate effect of our fellow Manitobans being admitted to ICU. So we're going to keep working to try to keep those, try to bring those numbers down. But it's a multifaceted approach. The public health orders are only one piece of that.
Dr. Reimer, it's Michelle from CTV. What can you tell parents about how the in-school vaccination clinics will work, since they likely won't be there?
So parents can expect to receive fact sheets and consent forms ahead of time, so that they do have time to review the information and also have time to talk with their children about the information as well. And then they'll be very similar to how we've done school-based vaccine clinics for decades, where we'll have our public health nurses along with some of the other new immunizers going to the schools and setting up clinics in one of the rooms in each school, and having the children who have had those consent forms returned coming in to meet with one of our immunizers one-on-one to review the situation and provide that dose on site. And then, like we do anywhere else, we will have observation for a period of time after the child receives the vaccine to ensure that they don't have something like an allergic reaction, or more commonly, something like fainting from stress related to getting a vaccine. And then they can go back to their classrooms after that. So we're working with the schools to make sure that this is comfortable for the kids, that this is being offered in a place that they're familiar with, and that parents have lots of time to review the information ahead of time before signing and returning that consent form.
And are
Dr.
there
Rusin,
any?
Oh, go ahead.
Go ahead. Oh,
Okay.
I just wanted to follow up on that. Sorry, I'll just quickly do this. Are there any schools or regions where we know there aren't going to be any clinics? So if parents are kind of holding out to get their kids vaccinated in schools and it's not going to happen and they do have to go to a doctor or pharmacist, what areas would that be?
I don't have the list of all of the schools and dates in front of me right now, but that's certainly something that you could connect with the communications team, and they can see what summary they could provide based on the school division level information.
Okay, time for maybe one last question before we wrap things up.
Okay, Dr. Rusin, I was just wondering, how long does it take to sequence for the Omicron variant?
Yeah, that varies on the lab the capacity, number of samples received. So I don't have a specific number on that. It really can be variable depending on the lab on that day.
Okay, and I just want to confirm one more thing for Taylor at CHVN. I think we might have had some audio issues with the question or perhaps the answer. We're trying to triple check, Taylor. We can get back to you. Our understanding is that the public health orders do not apply to a gym class. So the vaccination, a student wouldn't necessarily be banned or blocked from gym class if they're not vaccinated. But we're working to confirm that unless Dr. Rusin has any clarity on that here, we can take that away and get back. I wouldn't want any confusion as we leave this call about gym class.
Thanks.
Okay, on that note then, we will wrap things up. Thank everyone for their time and a good afternoon. This concludes our briefing.
Hey, Glenn,
Yes.
can you tell us when those test positivity rates are going to be updated? They were supposed to happen at 12:30.
As soon as possible, Brittany.
Thank you.